So this is an interesting patient. Let's start off with dilated aortic aneurysm. And one thing that I like to show the audience and you guys is that when an individual has a certain complaint, from a clinical standpoint, you want to have a list of possibilities as what can cause that one thing. So what are the list of possibilities that can cause a dilated aortic aneurysm? Well, hypertension is one. Systemic inflammatory disorders are other. Vascular disease, atherosclerosis is a possibility. So we want to put these things together in terms of what are the possibilities, because then that's going to direct what other tests we do. We don't want to just randomly order tests. Welcome to Montgomery Heart and Wellness. We're here at our health center. So who has the first patient?
I have patient Gigi. She is a 69-year-old female who came in because she had a 4.1 centimeter ascending aneurysm that she was diagnosed in December of 2020.
So it's a 4 centimeter ascending aortic aneurysm.
Yes.
When was that diagnosed?
December 2024.
Okay.
And her goal was to see if we can be able to either reduce that aneurysm or not have it get any bigger. During that time, she was also complaining of chest pains that were occurring 3 to 5 days per week and some upper back pain, basically generalized pain. We did a comprehensive lab on her cardiac workup. She was placed at EBO, some infusion therapies, Plaque X. She also got on premium greens and D3 with K2. On the second week of seeing her, she was saying that she felt a bit better, like her energy increased. The pain was gone. The generalized pain that she complained of was gone. We reviewed her labs with her. Her lipoprotein A at the time was elevated. It was like 519. LDL was elevated 126. But we're going to recheck those labs at the end of her therapies with this.
So we're checking inflammatory markers like a C-reactive protein or sed rate. The beginning of those, were any of those elevated?
No, just the lipoprotein A and LDL and the myeloperoxidase.
So the interesting thing about this patient, she presented essentially a chief complaint of a dilated aortic aneurysm. But then she had these other complaints. Now, generalized pain, did she have chest pain, discrete chest pain also?
Chest pains that she said were occurring 3 to 5 days.
Was like that sharp stabbing pain, like tightness or pressure, do you know?
I think she said more of a pressure, yes.
She did have a lot of hip and knee pain. That has gone down a lot.
Mm-hmm.
And we still also ordered a perfusion study as well because of the high lipoprotein little a and LDL. She hadn't had that checked, so a lot of that could be coronary actually in nature.
We take the aortic aneurysm. It's dilated. And so what can cause a dilated aortic aneurysm? I remember in medical school we have morning report. So let's say somebody presents that case and they may cut them off right there. This 69-year-old lady coming with dilated aortic aneurysm, stop. Montgomery, what's your differential diagnosis? So what are the list of possibilities that can cause a dilated aortic aneurysm? Well, hypertension is one. Systemic inflammatory disorders are other. Vascular disease, atherosclerosis is a possibility. Okay. Syphilis. Anybody want to take a guess at how syphilis can cause a dilated aortic aneurysm?
It can cause like a vasculitis and systemic inflammation. I mean, it can degrade your neurological system too.
Yeah. I'm asking an unfair question since you were brave enough to answer. What's the Latin word I'm thinking of that means vessel of the vessel? It's not lucky my Latin's bad. It's just vasa vasorum. It's the vessel of the vessel. So you know what I'm talking about.
Yeah.
Tell me, share.
The infection itself, like in the vessels or the supply for the blood vessels.
Yeah. The vessels that supply vascular flow to the aorta become diseased with syphilis. Do we think she has syphilis? No, not necessarily. But if you don't think about it, you'll never diagnose it. So then what else goes up with a differential diagnosis?
More like autoimmune or connective tissue disease.
Connective tissue disease. So then that becomes more prominent as a potential cause. Then you mentioned what? LP(a) is being elevated. So atherosclerosis is another cause. So we want to put these things together in terms of what are the possibilities, because then that's going to direct what other tests we do. well on just running it or a test. Given the possibilities of autoimmune and vascular disease, we came up with a treatment plan because even though we don't have a direct diagnosis of what's happening, we know that if we treat these both conditions can be treated in a similar fashion, which is what? Nutrition, anti-inflammatory, the ozone treatment helped. Even though we didn't have discretely elevated inflammatory markers in the blood, we had good clinical symptomatology of systemic inflammation. And by the way, normal inflammatory markers in the blood does not rule out a systemic inflammation. The systemic inflammation is all tissue-based. And oftentimes you have to get tissue, which you can't always do. So she improved significantly in what period of time with this treatment?
In about 2 weeks.
Wow. So 2 weeks' time, she got better with this therapeutic approach. Where are we now in her course of workup and treatment?
So she has been in Houston because she moved to Houston just for the treatment. So she's been in Houston for like 3 weeks now.
So I think she has 1 more week. Then we'll redo all the tests and review her other heart scan. But her blood pressure's been coming down. So I think at the top of our differential was just hypertension and atherosclerosis as the cause of the aneurysm, because she's been diagnosed with osteoarthritis. But, we tackle it with those treatments like the ozone and the diet, because that helps all the cells and all your tissues get better from really any disease process.
Yes. And were we able to wean any medications yet, or are we still working on that?
Currently, she's just taking amlodipine, the 10
So
milligrams.
just the one.
Just one medication.
Because I think she was on 2 blood pressure meds.
Okay.
And now she's on 1, and probably next visit we'll reduce it or stop it.
Wow. So very exciting case. The patient come in with a aortic aneurysm, and it'll be exciting to know if that aneurysm decreases. Typically what we do is we'll have them follow up with a thoracic surgeon. So when she goes back, have her see a thoracic surgeon. They can follow up on a regular basis to make sure somebody's observing this on a regular basis. But we may repeat some imaging over time ourselves. So fascinating case. Again, it shows you how this approach can have an impact in a fairly short order. But the thinking must be broad. We can't just on a willy-nilly basis give a drug or do a test or prescribe a treatment unless we think about what's happening. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.